you're probably asking yourself, why can't I get a good night's sleep? Is there an answer to this? Well, you've seen so much stuff on television. You don't know what's right or what's wrong, and you know that I would never bring you anything that I didn't think was a good thing. Eva Ovitt is with us today, and she's involved with a wonderful thing called
Total Sleep.
Total Sleep. Mm-hmm. Now, we are actually in a room that you do the sleep testing. What do you call? Tell me about this place.
You're at Total Sleep. We are a 6-bed freestanding facility. By that I mean we're not connected to a hospital. We're not affiliated with any hospital group here in Birmingham. We're freestanding. So anybody can come here pretty much. We have 6 beds. Each of the rooms is similar to this room in that we have testing equipment that can monitor how they're doing. A lot of people don't quite understand what having a sleep test is all about. The most common question we get is, well, why do I need a sleep study? I sleep just fine. But in sleep medicine, we're actually looking more at what you're doing while you're sleeping. Are you breathing? Is it healthy sleep? Everybody sleeps. In fact, you sleep about a third of your life. I don't know if you knew that or not, but
yeah, I do.
Yeah, a third of your life. So a lot of people don't realize how important healthy sleep is. Sure. So what we do here at Total Sleep is we provide sleep medicine, we do the sleep testing, and then we also do sleep therapy. And those are all very important things.
Well, you just didn't wake up one morning and say to your husband and to your partner, Kelly, call them on the phone and say, oh, let's open up a sleep clinic. I mean, it didn't happen that way. I mean, this is a beautiful place. Mm-hmm. I noticed this is is this a queen size bed? Do you bring friends with you when you come here?
No, well, you know what? As a matter of fact, the room that you're in is a room that if someone needed a caregiver with them, they could come and stay with them. But no, sleep testing is just for the individual that comes.
It's not a party room.
It's not a party room, yeah. No, or if someone that's under 17 or under 18, they would certainly have a parent with them. That kind of thing, yeah.
Oh, that young?
Yeah, yeah. We don't do the pediatrics here, but we do about 16, 17-year-olds and up.
Okay.
Yeah.
So where do these patients come? Okay, let me get the other question. Mm-hmm. Okay, so there you were, you had this idea, mm-hmm. but it came from some education from the past or from experience from the past, did it not?
It did. My husband is a clinician. He's a respiratory therapist by training. I'm an occupational therapist. My husband and I have a history of owning a company, a durable medical equipment company that focused on respiratory and sleep equipment. And my partner and her husband, Kelly and Mike Waits, also had a similar company, multiple companies actually. And Mike and Kelly actually have a facility that's similar to this down in Prattville and in Montgomery. And they approached us this past winter and said, we're doing this. There's really a need for something like this in Vestavia, kind of that's not affiliated with a hospital,
right?
Something that anybody can come to. And we want to do something that's different, that when you have to have a sleep study, you're thinking hospital and kind of drab surroundings and having to go into a hospital room with a hospital bed, you're going to be uncomfortable. We wanted to do something a little bit different. So we created an environment that's more like a boutique hotel. We have very compassionate, amazing staff and fine linens, extraordinarily comfortable beds.
So when you think about doing these sleep studies on somebody, mm-hmm. what first comes to mind is they put this thing on your head. Mm-hmm. No.
Well, no, not a thing per se, but like 9 little things go on your scalp to, people don't realize
But you're not putting on a helmet.
Not at all.
No,
They're very small little electrodes that are attached with what we call a paste that is put up in certain spots on your head that monitor what stage of sleep you're in and what your brain waves are doing. We can actually tell if somebody's sleeping and what stage they're in and if they're waking up. Your heart rate's monitored, your oxygen levels are monitored, your respiratory rate is monitored.
Yeah.
Movements. Yeah.
So do the patients just find you in the phone book?
Well, some do, actually. Some do. Others are word of mouth, but mostly internal medicine physicians, family practice physicians, pulmonary physicians, cardiologists, psychiatrists. They are looking at their patients and their patients are complaining of certain symptoms that the most common are excessive daytime sleepiness and morning headaches and high blood pressure, cardiac issues.
Really?
Yeah. And so if the doctor thinks that they have enough of the symptoms of potentially having sleep apnea, they'll order a sleep test.
Yeah. See, sleep apnea seems to be a common thing you see all over the place.
Yeah.
You know, all these things on television, by this, by the cleaner.
Yeah.
William Shatner puts one in his nose. I don't know what he does.
Exactly. Yeah.
So, but you also have a medical director?
We do. Dr. Gerald Day is a pulmonary sleep physician that practices primarily in those two areas, and he comes out and can see a patient as a consult.
Yeah.
He actually, if he gets a referral from another physician, he'll look at the referral and just make sure that they're appropriate for this environment. If they had many multiple what we call comorbidities or things that might be dangerous to kind of do in a freestanding facility,
Right.
it may be better for them to be in a hospital setting if they've had
Right.
multiple hospitalizations recently, those kinds of things. So he'll make sure they're appropriate for our setting, and then he'll write the order.
Is that for everybody?
For everybody? Yeah.
So
Yeah.
everybody is sent here by a physician, or 80% of them,
Sure.
or by a physician, and then another physician.
Doesn't have to see them, just has to review their information
Yeah.
to make sure they're appropriate.
Right.
Yeah.
Make sure
Yeah.
they're okay.
Right.
Okay,
right.
well, so now we scratched the surface. So I'm going to ask you to come back, and we're going to talk about CPAP and all these other things. Would that be okay?
Sure.
All right.
Okay.
Next week, you're going to see more, or maybe next month, but you're going to see more on how to sleep correctly.